In the scapular region, we see several muscles that take origin from the scapula and gain insertion into the humerus. These are the deltoid muscle, the supraspinatus, the infraspinatus, the teres minor, the teres major, and the subscapularis. Here some of the muscles are shown on the right, while other on the left side for convenience. Most of the muscles of the scapular region are covered by two of the muscle we discussed when we studied the back. These muscles are trapezius and latissimus dorsi. Let's jump into the details of these muscles and go through their origin, insertion, and action one by one. Starting with the deltoid muscles. The deltoid muscle covers the region of the shoulder joint from the lateral side, the front, and the back. It is responsible for the normal round contour of the shoulder. That is the rounded appearance of the upper arm or shoulder. Since it is a large muscle, its fibers are divided into three, which have their own point of origin. Posterior fiber originate from the crest of the spine of the scapula. Middle or the multipennate fibers arise from the lateral border of the acromion process, where four septa of origin are attached, while the anterior fibers originate from the lateral one-third of the clavicle. Insertion of the deltoid muscle's fibers is at the deltoid tuberosity of the humerus, where three septa of insertion are attached. The nerve innervating this muscle is the axillary nerve, a branch of the brachial plexus. As for the actions or function of the deltoid muscles, the individual fibers have their own distinct action. The posterior fibers are extensors and lateral rotators of the arm. The anterior fibers are flexors and medial rotators of the arm. The multipennate acromial fibers are powerful abductors of the arm at the shoulder joint from beginning to 90 degrees. A multipennate arrangement allows many muscle fibers to be packed into a relatively small volume. As the strength of contraction of a muscle is proportional to the number of muscle fibers present in it, and not on their length, a multipennate muscle is much stronger than other muscles having the same volume. As we mentioned before, the deltoid muscle covers the region of the shoulder joint from the lateral side, the front, and the back. It therefore covers a large number of structures. Let's look at these anatomical structures in the horizontal section. First of all, we have two bones here, the upper end of the humerus and scapular bone, to be precise, the coracoid process. Then we have the origins of the long and short heads of the biceps brachii and of the coracobrachialis. We also have the tendon of long head of the biceps brachii in this region. Insertion sites of the pectoralis major, teres major, latissimus dorsi, and the long head of the triceps are also underneath the deltoid muscle. As for the vessels in the region of the deltoid muscles, anterior and posterior circumflex humeral arteries are present here. And the axillary nerve also passes in this region. We will discuss its branches at a later stage. That is all about the deltoid muscle. We will now move on to the supraspinatus muscle. The supraspinatus muscle originates from the posterior aspect of scapula, that is the medial two-thirds of supraspinous fossa. As for the insertion, the muscle passes under the coracochromial arch and inserted into the upper facet of greater tubercle of humerus. Its fibers are also inserted into the capsule of the shoulder joint. The nerve innervating this muscle is the suprascapular nerve, a branch of posterior cord of the brachial plexus. The supraspinatus works with the deltoid muscles to abduct the arm. Only the first few degrees are the isolated action of this muscle. In other words, this muscle assists the deltoid in the abduction of the arm at the shoulder joint by fixing the head of the humerus against the glenoid cavity. That was the supraspinatus muscles. Let's look at the next one, that is infraspinatus. As the name indicates, this muscle originates from the infraspinous fossa of the scapula. The muscular fibers are then inserted into the middle facet of the greater tubercle of humerus and into the capsule of the shoulder joint. It has the same nerve innervation as the supraspinatus muscle, that is the suprascapular nerve. But the action of the muscle is different to that of the supraspinatus. The infraspinatus muscle is responsible for laterally rotating the arm at the glenohumeral joint. Also functions as an adductor muscle. The muscle also stabilizes the shoulder joint and strengthens the posterior part of the capsule. Next, we have the teres minor muscle, which originates from the posterior aspect of the scapula, to be precise from the lateral border of the scapula. The insertion occurs at the posterior aspect of upper end of humerus, lowest impression on greater tubercle. Nerve supply of the teres minor muscle is the axillary nerve of the brachial plexus. The teres minor muscles laterally rotates the arm and stabilizes the shoulder joint. The teres major muscle's origin is from the inferior angle of the scapula and lower 1/3 of lateral border. Its fibers are then inserted at the anterior aspect of upper end of humerus, on medial lip of intertubercular sulcus. It is supplied by the lower subscapular nerve. This muscle acts as adductor and medial rotator of arm, strengthens capsule of shoulder joint and stabilizes it. The last in our list of muscles of the scapular region is the subscapularis muscle. The subscapularis and teres major form the posterior wall of the axilla. The contents of the axilla lie over them. Originates from the scapula, costal surface, medial 2/3 of subscapular fossa. Its fibers converge and are inserted in the lesser tubercle of humerus. Nerve supply to this muscle is by the upper and lower subscapular nerves, branches of posterior cord of the brachial plexus. The subscapularis muscle has the same action as the teres major. It medially rotates the arm at the glenohumeral joint. Those were the muscles of the scapular region. 4 out of these 6 muscles make a structure known as the rotator cuff around the shoulder joint. As the tendons of the subscapularis, teres minor, supraspinatus, and infraspinatus approach their insertions, they flatten, and their edges unite with each other. These 4 muscles are the rotators of the arm, hence it is known as the rotator cuff. The tone of these muscles assists in holding the head of the humerus in the glenoid cavity of the scapula during movement at the shoulder joint. The cuff lies on the anterior, superior, and posterior aspect of the joint. Since the cuff is deficient inferiorly, it is a point of weakness for the shoulder joint. That concludes our discussion on the muscular attachments at the scapular region. In the coming section, we will go through the neurovasculature present in the scapular region.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.